Data, data, data. It's one of the things that we figured out when we had a look at the budget review last week. And in this episode, myself and Andy are going to take a look at patient passports, national data libraries, federated data platforms, and so much more that's come out just in the past couple of weeks, which you probably haven't realized, but it's going to have a major impact on general practice, potentially in the next few months and years. So let's take a look at that as we take Enhance Your Primary Care and Learning. Hello, GP learners. Welcome to this episode. Myself and Andy are taking a look at this concept of a patient passport generated by Wes Streeting recently, backed up by the budget review, and a few other things you may not have heard about. This may be a bit of a deep one, but we're definitely going to be covering stuff you need to know about, particularly if you're involved in data at any point in general practice, aren't we, Andy?
We are, yeah. So this is something that snuck through in the budget last week, or was announced within the budget on budget day. And Wes Streeting had trailed this a few days before as well, sort of as early as the 21st. He was talking about patient passports on the radio and in a few publications, which we picked up on. And Gandhi sent me a link to the Guardian article, ahead of the budget, and then we got a little bit more information in the budget. So, I guess what Wes was talking about was two things really, and it might be worth just bringing up the Guardian article because that's where we
Let's
can
go for it, shall we? Yeah.
This journey. People can have a look if they want. But he was talking about that the government was going to bring forward legislation to enable the government to unlock the value which is in its kind of databases about public services. So not just the NHS, but things around policing and other elements of government and civil services, and use this data more effectively to unlock efficiencies. So we can kind of have more efficient policing, for example, and unlock a lot of efficiencies in organisations like the NHS, part of the analog to digital Darsley diagnosis transformation. And then in the budget, they announced that they were creating a new national data library, and they'll be bringing forward legislation to make this happen later in the year. So that's kind of what happened, I guess. In the article, they talk about two elements with regards to the NHS, and one is this patient passport concept, which is the idea that the patient has greater ownership of their data and their medical story, and that story is able to travel with that patient as they journey through the health system. So if they go to a hospital in Devon and then they're being seen at a hospital in Nottingham, the blood tests done in Devon should be visible as part of their record, and that wouldn't be the case now. People sometimes think it might be, but it's not. So that element, and then the other element of actually using the vast amounts of data that the NHS has about the population. We have a lot of population level data that would be quite valuable to researchers, and about how to realize the value in that, both in terms of making NHS services more efficient, but also potentially they discuss using that as a bargaining chip to get better deals on drugs and things like that, which was interesting. So that's where it started with the Guardian article.
And a similar article in the Pulse today that, friends of the channel and stuff and things. This one covered similar sorts of details. It talked about Wes Streeting's comments about, these platforms and stuff. I think the interesting part was the commentary from the current BMA chair, Philip Banfield, a little bit later down and stuff, where he talks about the fact that actually a lot of people don't realize that this is a problem. There's this myth around the fact that if you go to the hospital, they know exactly what your GP's been doing and vice versa and stuff. And actually it's not how data works, unfortunately, in the NHS. It is a myth, unfortunately, and this is because of the repositories that are kept, the data security aspects and stuff. And it mentions a couple of the other platforms that we haven't really covered in detail on the channel before. We probably will talk about a little bit more detail in a second, but these are interesting things that actually will change data access potentially, particularly with the new data use and access bill that comes through, maybe even replace them.
Yeah. So Gandhi, I guess we talked about some of the positives, potential positives of this. The patient journey would be better. Actually, I'd love to be able to also see my patients activity history, blood tests from hospital admissions. Actually, will probably save time because they might not need to spend quite as much time, crafting that discharge summary if I have direct access to what's happened. It's good to have a summary, but actually, you can see how they could be assisted in writing that by the new system or presenting that.
Not just that, Andy. Imagine how much many of our peers and colleagues will be, elated that they would no longer have to do, dumped work from tertiary care hospitals, for example, because actually those clinicians can now see this data with the patient's permission. So if patient from say super specialist tertiary care hospital down in London had their blood test done in Nottingham, that result would be visible to the clinic in London, and actually then they don't have to worry about the GP being involved in that journey and wasting everybody's time.
Yeah, so lots of benefits for people working in the NHS, and also, this is all going to benefit the patient in terms of improving care and saving duplication of tests and of being asked the same things, multiple times in different places as well. If people can just look at their medical history, rather than ask them. So that's going to be really good. And then they also talk. I hesitate to say selling. I know they talk about selling, but there's a sentence I think Wes Streeting has said in the Guardian article. It says, "We will also work through how to get the best possible deal for the NHS in return, whether that's extra funding, cut price deals for the latest medicines, or priority access to cutting edge treatments." So that's interesting. Certainly sounds quite transactional, but there is value in the data, I guess. And why shouldn't we get
Data is
value
the new oil
from something that the government and the taxpayer owns? So that's interesting. There was some downsides though, Gandhi, or some concerns that people have voiced about this. What were your first thoughts around potential risks or concerns, that would definitely need to be mitigated?
Well, whenever it comes to data repositories, there's always the concern about the integrity of those repositories and the access routes and stuff. And we definitely saw this a couple of years back when GPDPR came out, and how people were very much concerned around the handling of that repository of data, and who would have access, what is this process for analyzing those criteria, people wanting it and things. So there's definitely that aspect. I think there's also some concerns I've got in terms of what responsibilities is put on practices as data controllers. What impact does that have on their ability in terms of if that data was mishandled and misused? And again, we've seen that actually, there have been legislations put in place that have forced, almost tried to force practices to relinquish their responsibility, but still keep the liability with the partners because of being data controllers. And we saw this with the open access to patient records last year, that was written into the GP contract. They had to do it. But if actually, quite rightly, the BMA were challenging the fact that, doing it en masse without patient involvement was not appropriate. We still ended up there because it was written into contractual law, but there is still contention in how that worked. And I guess, the other part as well is, how is this repository going to be managed? How is this different to the other repositories that are also being created? So one that we haven't talked about yet is the Federated Data Platform.
Well, Gandhi, I was going to ask you sort of how this squares up to other plans that were in motion for, evolving how we store and use patient data, because, we were moving in a forward direction prior to this announcement as well. So does this look different to what's been announced before?
Well, I think it is. So what currently has been announced was that there's something called the Federated Data Platform. So this was effectively having data sets for different ICB area footprints in particular, but then managed by those areas on different markers. So things like bed capacities, social care aspects and things, various different things that would be managed as instances, kind of similar to how platforms like Mastodon, Blue Sky, that the alternatives to X everybody jumped to when Elon Musk took over Twitter and things, and use those principles of the data is accessible in a safe and efficient way, but also secure in the way that they are accessed and things. And I guess the question we now have is, what does this mean for the Federated Data Platform, which seems to be more about organizational data, so it may still exist, compared to the National Data Library, which seems to be more about patient level data from the way I've interpreted it, in terms of accessing, those kind of aspects, like you mentioned, in terms of research and possibly financial benefits for other organizations. And how is that different to the repository they're thinking of creating that sits around the data use access bill? Because that goes into more detail in terms of things like I think there's stuff around underground level data, so actually makes real sense, so you don't have to, what's underground, so when you start drilling you don't cause an accident, and then cost everybody loads of time and money because you've broken a water pipe, for example.
Yeah. And actually, the UK government's done quite well in digitizing, some experiences, not as complex as healthcare, but I'm just thinking about when when you buy and sell a car and do your car tax and things like that, there's an element of making some of that data public so you can check on the car that you're about to buy to know various things, about it and its history, for example, and when it was MOT'd, so that's useful. That's completely different, but there are areas where the government has done things to make repositories,
True.
public as appropriate,
I mean,
to improve the experience of citizens. So
yeah, I mean, their justification for this, they liken this to the open banking platform that has sped up the transfer of data for people when they move bank accounts and that kind of stuff. So, more confidence in terms of how that works, in terms of account level data, for approvals and that kind of stuff. So that's their thinking as to how it will work. And that has allowed, income to be generated as well through big businesses in addition. I think it's an interesting concept. I think the data use access bill is generally a positive stuff. But again, as ever, we keep saying this, the devil will always be in the detail. And what I hope this is not is a resurgence of the GPDPR and particularly the way that was managed, because many people quite rightly were concerned around the data access of that particular platform.
So I think there's concerns around the privacy for me, actually who can see it. So just very practical things. And these, once you highlight these problems, often there are ways to mitigate them. So, there's 1.5 million people that work in the NHS, and, I might be worried that, all of those people might be able to see my data. I'm sure that wouldn't be the reality. And actually in practice, where we have, say, people that patients know, that members of staff know, or relatives that might be registered with us, we have systems to bar their access from those patient records. And there's always an audit trail whenever anybody views a record. So, we can police those. So you can imagine that, privacy concerns could be mitigated on a large scale, although that would probably end up being quite complicated. Probably address that. Concerns around, just data security, data breaches, things like that. The bigger the repository, the bigger the prize for hackers or data brokers and so forth. So that would have to be really tight. And then there's just kind of that kind of practicality side to it. I think we've been, it's almost like nuclear fusion, isn't it? People have been talking about doing that for decades, and it's always been a few years away. And now people have been talking about a unified patient record for as long as I can remember in the NHS, and it's always been a few years away or the next initiative away, and it's never happened because it's a really, really complicated endeavor. So, I hope that data systems are mature enough to make it happen now.
Well, that last point's an important one as well. So part of the reason why we've not had a unified data record is also how the current system providers have played with that. So there's a question of how they will work to support it. We know that we've got the new entrants coming to the market as well. How will they change it in terms of the sharing of that data? And also we know that we've got newer entrants in the sense of particularly American and international companies coming to the UK looking to support, the data sets and that kind of thing. So how will they fit with, things like GDPR guidance, all these other kind of things that sit in there? It is getting more and more tricky to navigate.
I had a really simple question. So I think I might know the answer to this, but you will know it more than me. And it's an interesting question.
Hopefully.
So, so where does the data sit? The data that we are the data controller for at the GP practice. Is that on some servers up in Leeds at TPP headquarters, or where does that actually?
Yeah,
where
pretty
sit?
much.
Yeah.
I don't know if they're in Leeds, but yes, a UK-based server owned by TPP, similar for EMIS, similar for other organisations.
And the same for. And where they have a clinical record system in a hospital, I guess the provider will be hosting that data as well. Because there's the challenge, and then where would that data actually sit under the new system so that it is universally accessible? It just feels like there's a long way in terms of the system, architecture to go.
I would imagine
it
would need to be in a server that's hosted somewhere in the UK for GDPR compliance, which would be an essential part of it. It may potentially be an Amazon server, because actually AWS is one of the biggest server providers in the world, and actually still used by many organizations and stuff. So it may potentially be sitting in an Amazon server somewhere.
It may already be sitting in an Amazon server, to be honest. with TPP. Yeah, yeah. I just wanted to say, there's a lot. I'm sure there's lots of practical questions which they'll have to figure out, as they try and make this a reality.
Absolutely.
So, but it is, but it's coming, and I think there is promise in this, and actually we tend to be skeptical when the government announces it, but probably were they not announcing it, we'd be shouting from the hilltops to unify
True.
the patient record for the same sorts of reasons that they're giving. So, so hopefully they can make it happen and mitigate the risks.
So I think if you want to know more about these kind of data sets and stuff, let us know down below what you thought so far and what particular questions you've got around these. Absolutely, myself and Andy are happy to look at this in more detail. And actually, if you know more than we do, because let's be honest, there probably are people who know a lot more than we do on this particular topic and want to talk about it in more detail, let us know as well in the comments down below. Alternatively, if you want to catch up on that budget review episode that we talked about at the start, which was absolutely significant for everybody in general practice and pretty much in the UK, then check out this episode right here. As always, we'll be here to take and answer primary care and learning. We'll catch you next time. See you later.